Good morning. We're so pleased to have everyone here this morning. This is the Feasting on Knowledge Byte by Byte conference brought to you by your Orange County Strategic Plan for Aging from the Social Engagement and Technology Committees. I'm so very pleased to have as my co-host this morning, Ed Kasich from the Arvon Community Foundation. My name is Patty Mouton from Alzheimer's Orange County, and we welcome you to this very important sharing of information about using technology to combat social isolation. Ed, why don't you say a few words of welcome?
Thank you, Patty, and thank you everyone for joining us today. In addition to my role at the Irvine Health Foundation, I also serve as the chair of the Technology Committee of the Orange County Strategic Plan for Aging. Patty chairs the Social Engagement Committee. There are several other committees as well, and the Technology Committee is very excited to partner with the Social Engagement Committee on this effort. We are finding in this day and age of pandemic that technology has become more and more front of mind for people who are trying to help older adults and also for the organizations that are actually trying to serve those people. We're going to hear a little bit about how that can deal with technology can be used to deal with social isolation. I would encourage, by the way, the Technology Committee puts on monthly, almost every month there's a workshop. We're trying to engage with people on understanding technology as it relates to older adults and the provision of services and the improvement of older adults' circumstance. We generally put together topics around problems and solutions. So you hear about new ways to use technology or old ways to use technology to deliver new kinds of services or engagement. So the Orange County Strategic Plan for Aging website has a lot of information about that committee. We welcome anyone to either join the committee or to participate. We meet generally every month, the first Thursday of the month in the afternoons. Patty, sorry for the shameless plug for the committee, but we're always welcoming as many people as want to learn about technology as we can get.
Absolutely. No, we welcome that. And the Social Engagement Committee hosts a group called the Heart to Heart Council, which is a group of friendly visitor programs from all kinds of disciplines, from churches, community groups, grassroots efforts throughout Orange County. And our work there is to further and support the work of these friendly visitor programs. So we're very pleased to have you all with us, and this is our first collaboration of its type. So we welcome you to the day's proceedings. We'll go until about 2 o'clock. We'll have brisk scheduling today, so keep your pencils sharpened. You can download all of the handouts in yourself in the right-hand area where you see different parts of the control panel. You can download any of the handouts from the speaker slides to other resources, and we welcome you doing that. Your questions also you can ask at any time in the chat box, and they will be saved for the end after we've had our panelists. Then we'll start to address your questions. But we welcome your interaction and look forward to a very, very productive day. We couldn't do this work without lots of collaboration and support, especially the support of Care Choices Hospice and O'Connor Mortuary and SCAN Independence at Home. And we're pleased to welcome Christine Chow from SCAN Independence at Home. She is a gerontologist and is very active in community service of SCAN Health Plan. She's currently working from home in Buena Park with her husband, their Cavalier King Charles Spaniel, and 2 cockatiels. So welcome, Christine Chow.
Thank you, Patty, and thank you, Ed. Yeah, we're so happy to be here and to sponsor today's important event. So I'm with Independence at Home. We are the community service side of SCAN Health Plan. And my job is fun because our main role is really to give back to the community with no cost nonprofit programming for adults age 55 plus, as well as caregivers. And our goal is to keep people healthy and independent in the community, which seems like even more of an important, vital topic this year. So in Orange County, like many of you, we've adjusted our program. So we are now primarily telephonic or via video call. In Orange County, we have a behavioral health program for depression, anxiety, and stress. We have a medication safety program, friendly visitors, case management to connect people to the resources that they need. And we're also doing some fun, interactive health education via Zoom. So to learn more about us, it's independenceathome.org. You can follow us on Facebook or give us a call at 866-421-1964. Again, everything is no cost, and our goal is to keep people healthy and independent at home. Thanks for the opportunity to be here today.
Wonderful. Thank you, Christine. And thank you to SCAN for their support of this event. We surely appreciate it.
Thank you, Pat.
We'll move now to our first speaker. Carol Dupay is a licensed marriage and family therapist, and she serves as the clinical supervisor of senior services at St. Jude Medical Center, where she oversees community outreach programs for seniors, including a medical transportation program, the Caring Neighbors Friendly Visitor Program, fall risk assessments, depression counseling, and a variety of other really vital services. Carol is also the host of the North Orange County Senior Collaborative. She's a member of the Orange County Mental Health Board. She chairs the Orange County Older Adult Mental Health Council, and she publishes an annual senior resources guide, and that's just in her spare time. She has co-chaired the World Elder Abuse Day Conference, and she helps teach a free Senior Resources 101 class for seniors and their caregivers. As I said, she's a licensed marriage and family therapist and a graduate of Chapman University. She is the recipient of the 2011 Senior Care Hero Outstanding Social Worker Award and was named one of Orange County's 100 Women Making a Difference in 2014. Please welcome Carol Dupay.
So hello, I'm very glad to be here. I'm so sorry that you can't really see me, but just know that I actually am here, and you know, technology, what can I say? I'm trying to get in the picture, but it looks like it's pretty dark. So first of all, I just wanted to say how glad I am that you all can be with us today. We're going to be talking about a topic that I think many of you are already familiar with, but just in case some of you are not familiar with friendly visitor programs, we thought we would just give you just a little bit of an overview of what friendly visitor programs really are all about. So that's why we're saying everything that you ever wanted to know, but frankly weren't sure just who to ask. Here in Orange County, we have a number of different kinds of friendly visitor programs, and so we'll kind of talk about those. Okay, so Melissa, next one, please. What is a friendly visitor program? What's it for? It's actually intended to address a number of different things, including to address isolation. There are people who are pretty comfortable with isolation, but there are also a lot of people, especially right now, who are not comfortable with isolation. Friendly visitor programs can provide socialization and connection with other human beings. Feeling connected ends up being truly essential for all of us. We need that support that we can get from each other, and friendly visitor programs can provide that. It also helps to reduce loneliness and some of the repercussions of loneliness. Some of the repercussions of loneliness include things like heart disease, include an early the possibility of early onset dementia. People who are lonely are much more likely to be victims of elder abuse. They typically have a higher risk for fall risk. They're less medication compliant. Many different things, including elder suicide. That's another one. And friendly visitor programs can play a really important part in that, because we can address some of those problems early on before it gets to be a problem. Okay, next. So there are actually also quite a number of different types of friendly visitor programs. Some friendly visitor programs are only telephonic. And that means that I reach out to you and I talk with you on the telephone for a variety of reasons. That just is what's going to work best for you, or maybe works best for my program. There are other programs that are more in-person based, and again, different organizations and different individuals prefer that method. Some of them are faith-based, and there may be members of the audience today who have faith-based friendly visitor programs, and they may be named something else. It is nonetheless a way for faith-based organizations, churches, temples, to reach out to the individuals in their community who may have a hard time getting into any of the services. Sometimes they're socialization focused. So their primary purpose is to offer socialization to the individual. Other ones are task-based. So they offer different services, such as maybe somebody needs some grocery shopping done. Maybe they need some light housekeeping tasks completed. Well, this is a service that there are a number of different organizations that offer this type of a service, and those services are always welcomed by the older adults in our community. Some of them are community-based. So for instance, many of you are familiar with Laguna Woods. Laguna Woods is an example of a community-based friendly visitor program, or they have a friendly visitor program because it's limited to a specific geographic locale. Some of them are villages. There's a village, for instance, in Huntington Beach, and that is also limited to a specific geographic locale. And that is, but it's not just in one set area. Actually, I think that village extends clear to Fountain Valley. So there are a number of different ways that that friendly visitor programs might even exist. Typically, friendly visitor programs offer different services too. So the services may include referrals or resources. Not all of them do. They're all actually quite a bit different. So it's a good idea to call in advance and check out what any particular friendly visitor program offers, because they are different. Some of them offer transportation, other ones do not. And when I say transportation, maybe they offer transportation with the friendly visitor person that will take them to an appointment, maybe take them to grocery shopping for an outing. One of my individuals today, one of my volunteers is taking one of his clients to get his car smogged. And that's what they're doing today for their friendly visitor program. And they're doing that today. So it's different kinds of things. Sometimes it's tasks performed. There may be case management that is offered. And sometimes there are different activities that are either socially focused or faith-based events that the friendly visitor program may offer as well. So again, they're all just a little bit different. Okay, thank you, Melissa. Different, and I should say too that friendly visitor programs always rely heavily on volunteers. We could not exist if we did not have volunteers. That said, we have to be careful about the volunteers that we have. First of all, we need to be very choosy about who we have volunteering to work with the members of our community. We need to make sure that these are compassionate individuals, that they are willing listeners, that they're trustworthy, and that we can count on them. They need to be able to be consistent. Most friendly visitor programs involve some kind of screening, and the screening could be like they're going to match one person with another. It's not going to help if I match someone who is Spanish speaking with somebody who is Vietnamese speaking? Well, I mean, there may be limitations. So we need to match people. We may need to do some training of the volunteers, and we will almost always certainly do a background check to make sure that whoever we have as a volunteer is going to be somebody that isn't going to cause any harm to the older adult. It's also important that we find out how much time do you actually have available to spend with the older adult. What's your scheduling like? Let's figure all of that out too. And again, different organizations, different programs have different requirements for the amount of time that is going to be asked of them. Typically, there is some type of supervision that goes on a regular basis, some type of reporting, and including, when I say reporting, the other reporting to perhaps to Adult Protective Services if need be, or to the police if there is any kind of a problem. But there are almost always some type of reporting requirements, and there's typically some kind of supervision that goes on as well. All right. The program format or the organization of the program typically includes HIPAA compliance, discussions on confidentiality. We usually have people acknowledge that they are willing to and agree that they are willing to comply with the HIPAA laws and that they will respect confidentiality. I know here at St. Jude, and I'm sure this is true at other places as well, that we check the driving record and that we have people sign liability forms. And when I say check the driving record, mostly we just need to make sure that if they're going to be driving, that there is insurance involved and that it's taken care of. We talk about the frequency of contact. Is this once a week? Is this once every a month? What type of contact is there? Is this going to be in-person responsibilities? Are you exchanging telephone information with your individual? Those types of things. And then there's always the description and the explanation of the program to both the participant as well as to the volunteer. We will almost always want the signature of the volunteer and sometimes of the participant acknowledging that they have that they understand what the policies are and they are agreeing to the policies that the organization has in place. It's also important that we take care of our volunteers in the sense that we need to make sure that compassion fatigue doesn't overtake them. We want to make sure that our volunteers are recognized. We need to find ways that we can acknowledge the services that they offer. And we can do this in a number of different ways, whether it's with a personalized note. Essentially, we want to make sure that volunteers feel like they are part of the organization, they're part of the program that is being offered there. Another really important piece, and this comes during the supervision, it comes during the training, has to do with boundaries and the importance of establishing healthy boundaries. Make sure that you're not getting taken advantage of, either with your time or your own personal resources. It's important to be flexible, but it's also important to be able to say no when necessary. We want to make sure that we work within the program guidelines and that those don't get broken. We want to make sure too that volunteers aren't overextending themselves, either emotionally or physically. We don't want anything. We don't want you to have back problems. We don't want you to have a fall risk. We want to make sure that you are safe too. We also want to make sure that there is not an unhealthy dependency on the volunteer. And that can happen very easily. And again, that's where the healthy boundaries come in. We don't want the older adult to become too dependent on the volunteer and then the volunteer not be able to follow through on whatever the the initial problems or the initial stated requests were. And then we want to make sure too that that the volunteer does self-care, that the volunteer is making sure that they are taking care of themselves. I'm going to invite you to do just a very quick and easy breathing exercise with me that you can do throughout the day, anytime. So something that I'll have you do right now, all of you, is just drop your shoulders. Turns out that's almost all that you need to do, because as soon as you drop your shoulders, you immediately open up your lungs. And when you open up your lungs just by dropping your shoulders, you allow more oxygen into your bloodstream, and that simultaneously gives you both more calm and quiet energy. You put more oxygen into your muscles, and that helps them to relax. And you also get more oxygen into your bloodstream, and that goes directly to your brain and helps you to think more clearly. So take a deep breath and know that you'll probably be dropping your shoulders often, because almost as soon as we drop our shoulders, we hunch them right back up again. We're kind of funny that way. So you'll need to be mindful of dropping your shoulders on a pretty regular basis. But when you do, you immediately and truly just about effortlessly begin to get the benefits of oxygenation into your system. So make sure that you are replenishing yourself in your own health habits, whether that is through nutrition or exercise, replenishing your mind. Take time to read or journal and rest. Get good sleep. Replenish your own spirit through meditation or quiet reflection. Make sure that you're connecting with replenishing people. Unfortunately, not all of us are qualifying as replenishing people, so find those individuals and discover replenishing activities for yourself as well. Thank you, Melissa. Resources and people who you can talk with to find out more. There are a number of them here. The Orange County Strategic Plan on Aging for Aging has got a great handout. It's got a whole handbook, I should say, on friendly visitor programs, and it's really comprehensive. It's great. Make sure that you take advantage of that. Council on Aging has got a Reconnect program, and all of these programs are all just a little bit different from each other. The Laguna Woods program, Meals on Wheels, here at St. Jude, Senior Services, we all have friendly visitor programs, and they're all just a little bit unique. So if you know that you need a certain thing, make sure that you call and find out, or email these individuals, and they will give you the information that you're looking for. And thank you very much for all that you do. Truly, you rock.
Carol, thank you. Good stuff. It is my pleasure and privilege now to introduce our next speaker, Mike Splain. And Mike is the owner and the principal in Splain Consulting, which is an advocacy and government affairs consulting firm based in Washington, D.C. Good place for one, I guess. Immediately before this firm, Mike was the director of state government affairs in the public policy division of U.S. Alzheimer's Association. And among Mike's current clients, he's a consultant to the Alzheimer's Association CDC Healthy Brain Initiative. He was recently the lead on behalf of the association on its roadmap for Indian country document and the related outreach. He's also in the past been policy director for Alzheimer's Disease International, the managing partner of a related company, Recruitment Partners LLC, which focuses on improving the pace, the quality, and diversity of recruitment into dementia clinical trials. He makes his home in Columbia, Maryland, where he has an amazing wife, Sandy, and he enjoys occasional inspirational visits from his 3 daughters and 2 grandchildren. I can attest to those things being inspirational. And Mike, take it away.
They're also exhausting.
Yes.
5-year-old boys are exhausting. Well, good afternoon, Melissa. I'm looking for control of the slides.
You are sharing your entire screen right now. So
I am
if you
sharing
could
my
just pop
entire
up the
screen.
slides, you'll
So
be good
I
to
should just pop up my slides. Bless your
go.
heart. We can get there. So these reflections, where do these reflections on social engagement and older adults come from? And I want to point out that our company has been involved for the last 2.5 or 3 years in a number of activities related to persons with Alzheimer's disease and related disorders who live alone. And there we go. And now we go to slideshow. All right, Melissa, tell me I'm right.
You
Good.
are good to go.
Okay, so our company has been involved for the last 2 to 2.5 years in a number of activities focused on persons with dementia who live alone. These include conducting now in 11 different cities and now 1 online in our COVID world, day-long summits to stimulate thinking and action on supporting persons with dementia who live alone at the local level. We've also been involved in many different forms of action planning around live alones. And most recently, we are, with the support of a couple of our clients, we are engaged in building an online community of, by, and for people with dementia who live alone. That's called Living Alone and Connected, that you can find on and through Facebook. So the reflections that you're going to hear are coming from, I guess, the practical side, as well as maybe a bit of philosophical side of supporting and thinking about supporting people with dementia living alone, which adds an extra element of difficulty. I want to disclose that, and we are part of our clients list. This is our full clients list, and none of my clients have any control over this presentation, other than the fact that Patty Patty influences me. What can I say? Patty Mouton influences everybody. So the agenda today, I've got a couple of, like any good keynote, I've got a couple of famous guy quotes. I want to talk through, although it was hinted at, I want to talk through a little more detail of the difference between social isolation and loneliness. But I also want to talk about health impacts. And then what have we learned are barriers and facilitators for tech use. Charles de Gaulle, the famous French philosopher, you didn't know that. You thought he was a political and leader and a general. But in his old age, he declared, "Old age is a shipwreck," to which the great actor who acted well into his late 80s, Maurice Chevalier, replied, "Consider the alternative." Of course, they didn't say that. They said it in French. But in reflecting about social isolation, I go back to a now 20-year-old book by Robert Putnam called Bowling Alone. Putnam found one little fact. He was kind of like the 60s, 70s writer Vance Packard, if anybody remembers Vance Packard. He'd find and string together a couple of facts and unravel it and think through what it meant in terms of a social trend or a demographic trend. Putnam discovered that in 1995, from 1995 to approximately 2019, more people in America were bowling than ever before. But fewer people were bowling in leagues than in ever before. And he took this theme and took it apart, and he talked about how this fact and other related facts that are well exposed in the bestseller indicated that we were in a period in America in which community was collapsing. In fact, he wrote about how we were moving from a communitarian existence to tertiary communities. So he theorized that we're not part of a membership organization such as, I'll pick one that I'm a member of, AERP, in the same way that we might have in previous times been part of a bowling league, a union, or a family. That we were seeing the rise of tertiary organizations, and I would argue today that we've gone to the internet to full bore quaternary organizations and maybe even quintiary organizations as the mainstay of feeding our desire, our need, our hopes around being communitarian people. I raise this because if technology is the answer, what was the question? I'm kind of doing this a little bit backwards, but I would encourage you to think about, is the question we're trying to answer when we think about technology in older adults at whatever scale, one-on-one within our families, trying to get my mom to use that iPad, which by the way, she's better at it than I am, and she's 89, or is it at a community, a family level where we might have to do Thanksgiving via things like Zoom, or is it at a social level, such as a meeting like this? So if technology is the answer, what is the question? And I think in part, some of the question we're trying to answer, some of the need we're trying to supply is a search for meaningful community in our lives. Well, I'm a data geek, and I pulled some data, but I'm here to tell you that households of older persons living alone are the fastest growing type of household in America. And as you see on this chart on the far right, and the percentages in Orange County and in nearby counties in California approach 40% of households involve a 65-year-old or older person living alone. This is an extraordinary combination of social and economic demographics. It's certainly in almost no other country on earth could be affordable or sustainable. And there could be some argument whether or not that's true here in the United States over time. Remains to be seen. But it is the fastest growing type of household in America. Keep in mind that this estimates are built on the 2010 census, updated by estimates between 2010 and 2020, and demographers that I respect very well suggest that an average place in the United States will see, on average, 45% of our households are a person living alone over the age of 65. So terms are important when we're talking about a social problem or social issue. And I just want to highlight that we sometimes use terms to mean the same thing when in fact they don't necessarily 100% correspond. For example, in my field, in Alzheimer's disease, we frequently see people use Alzheimer's and dementia as if they're the same thing. And of course, dementia is a symptom, Alzheimer's is a cause, but we get casual, we get sloppy. I think we see the same thing in the social isolation field, which owes a great debt to John and Stephanie Cacciapio from the University of Chicago, who really, through developing a whole new field starting 20 years ago called social neuroscience, really tried to identify that there is a difference between being socially isolated and being lonely. In their minds, social isolation may or may not lead to loneliness. And in their studies, and I've got some of their links to some of their work in this slide, and the slides will be available for you, they discovered that it was really loneliness that was the killer more than being socially isolated. I'll put it another way. when we do our summits on living alone with Alzheimer's, we try to start them with a person who is navigating living alone with a diagnosis of some form of dementia. We were in Missouri 2 years ago, and the woman who was our keynote speaker, our kickoff speaker, came to the microphone and she said, "I'm sorry I'm late. I kind of missed on my ride, but I'm glad I'm here now. And I want to talk to you about living alone with Alzheimer's disease." And it's the most important thing I want to tell you is that there's living alone with Alzheimer's disease and there's living alone with Alzheimer's disease, and they're different. And the 70 people in the audience turned around and looked at me and said, "What's going to happen next?" But as she went on, she talked about how she had constructed, very carefully, she had constructed both the material supports for her life, such as mobility, groceries, somebody to check up on her on a regular basis, a security system in her building. She had constructed the physical needs of life as well as the emotional needs of life in terms of participating in a small church community, being a volunteer with a children's group of singers. She had constructed a life that, although she lived in a single person household and was physically isolated, physically socially isolated, and was feeling isolated because her thinking was becoming increasingly disordered, she wasn't lonely. She wasn't lonely. And I think this distinction, this difference in terms of social isolation is distinct from loneliness, or it overlaps loneliness, is something for you to consider as you continue to plan your technological solutions for supporting people, because you may very well find that something that works to keep people from being or feeling isolated may not necessarily meet the emotional side. I was intrigued by our friend talking about friendly visitors in that it's an interesting blend of dealing with both the material support of life as well as the emotional support of life. I thought that was really intriguing. Well, what causes social isolation in elders? And number one, first and foremost, is demographics. It's how we have chosen to live. As a country, we have tended in the last 100 years to increasingly have single person households because of not living in multi-generational households, although that may very well be different depending on what culture one is a part of. But the nuclear family and then the related living not in multi-generational households, the demographics are certainly driving or a driver for social isolation in older people. This is not unrelated, the housing choices and styles that we have to live in, and even the influences of our culture in suggesting, for example, that if your older children live with you, there must be something wrong, or perhaps you need a caregiver. I'll tell you, we had one of our 3 daughters recycled after college. She graduated in 2008, right into that economic recession. And I have to say, she was really good company. But I'll also say that there were real questions about whether or not our friends, our set, if you will, we were in our late 50s, early 60s at the time, and our set of friends were constantly wondering whether or not there was something wrong because Sarah was living with us. It was actually kind of fun, and she still every now and then shows up with a bottle of Irish whiskey for her old man, so it's not all bad. Social isolation can also be caused by health issues. I mentioned dementia. I think on some level, diagnosed or not, people with disordered thinking because of, even in the early stages of dementia, begin to be fearful and may begin to disengage for fear of making a mistake or fear of other fears. That's a health issue that I'm very well aware of. But there are other kinds of health issues that may increase people's social isolation. if you ever listen to and work with people with physical disabilities, people that are wheelchair bound, people that even people that have to do things like maintain healthy eating, blood checks, and insulin for diabetes, all will tell you that their health condition can be a cause in their life of social isolation. Transportation, what am I'm talking to Californians. Oh my God. We know that we have a car culture, and that if people have difficulties in continuing to drive, accessing other opportunities for transportation uh, are difficult. Mobility is, or lack of mobility, and I don't mean within your home, but I mean across homes, or between our home and other things that we want to do, is a major cause of social isolation of older persons. And it's one that, frankly, I don't think we've yet developed the best of answers for. Although it was really fun getting my 88-year-old mother to take her first Uber ride some 6 months ago before the COVID scare really hit. I think social isolation is in part can be caused by personal preference or convenience or choices that people make. We have an increasing number of people, for example, that have always been single who are now aging. And so to see a rise in single person households when we have an overall increase in a number of people that have at one time would have been seen as, certainly older women or women would have been seen as a countercultural choice to live one's life single, is increasingly been not thought of as odd and in fact supported. Hard to raise this question, but social isolation in some cases is caused by and exacerbated by substance abuse, both alcohol as well as illegal substances, although it's a moving target to decide what is an illegal substance looking at our recent election across the country. Nonetheless, persons with real substance abuse problems are going to self-isolate or be shunned and not welcome necessarily to be part of a community. Um, it's what happens. I think there are biases, there is real ageism, and of course, COVID-19 is a layer on all these causes of social isolation that just is made all of these more evident and worse. I'll also point out that recent information from the Centers for Disease Control indicate that LGBT seniors are at much higher risk of social isolation and loneliness, in that they are twice as likely to be living alone as adults and as aging adults, and that those who are living with HIV also face significantly higher rates of isolation. So this is a group that is at higher risk of isolation. So is technology the answer to building more community among and between persons that perceive themselves to be socially isolated or lonely? I want to talk a little bit about what we've learned, some of the barriers are to facilitation, to technology use, talk a little bit about what we've learned. Our facilitators offer a couple of recycled ideas that are coming back into play now in a COVID era, and under the rubric of old tech still having some legs. When we talk about what works, I want to give a nod to the fact that there are different levels of evidence about what works, but Gardner et al. Did a major integrative review of all interventions that have been through rigorous scientific testing that are aimed at reducing social isolation and loneliness among older people. And what they found in reviewing the formal review of the literature was that a number of social facilitation interventions, including senior centers, friendship clubs, video conferencing with distant family, as well as adult day health, This cluster of social facilitation interventions have the highest level of evidence that they in fact reduce social isolation and loneliness among older people. Interestingly, they also reviewed a number of psychological therapies that are available either one-on-one or one-on-a-group, and they discovered good support for mindfulness training, humor therapy, and structured reminiscence groups as having a high level of evidence of reducing social isolation and loneliness. So you can see here under social facilitation, the thought that video conference with distant family has a substantial amount of evidence behind it that it would reduce social isolation and loneliness. And although not studied, because this review was done in 2018, based on what was published through early 2018, you might be able to extrapolate that either a mindfulness training, drop your shoulders, I heard it, I did it, mindfulness training, humor therapy, or a reminiscence group, if delivered electronically, might in fact come close to the same results with that therapy being delivered previously face-to-face. Our experience in talking about technology use is both in most recent days has been in a project we're doing to test new models of recruiting persons in African American communities, low income communities in New York City and in Syracuse, New York, to become engaged as research volunteers and participants. And we've learned an awful lot that we're writing up right now about the barriers to technology use in that community that we think are almost universal. And first and foremost is that older adults may feel unconfident about using technology. There's a constant fear that you're going to break it, compared to my 5-year-old grandson who's had a computer in his house in a way that is as common as a toaster was for somebody my age. So I think there's a feeling of or a lack of confidence in being able to use technology. We have underestimated cost as a barrier to being involved in technology. But when all's said and done, $40 to $60 to $80 to $100 a month for internet service platforms and related cell phone technology may be a significant cost for people with a reduced or modest income. We have de-jargoned our guidance and our instructions in working with older adults with technology, because we have found not only the alphabet soup of acronyms, which I've decried my whole life, but also the jargon that we just so slip into so easily without even thinking about whether or not the receiver knows just what the hell we're talking about. And because they're not confident and they don't want to look dumb, they might not tell us. Our biggest learning about this came when we told a group of older adults who were our advisory body that we'd send them a Zoom link for our next meeting. And very kindly, about an hour after that instruction was given, one of the older adults called our counterparts in New York City, Mount Sinai Medical Center, and said, I hate to tell you this, but I'm not quite sure what you just said when you said I'll send you a Zoom link. Cognitive impairment, like it or not, persons with, 1 person in 9 over age 65 has Alzheimer's or related dementia. And technology can be difficult and can be more difficult for people with even light cognitive impairment because of the steps and the short-term memory, as well as the organizing of tasks that are involved. There are real issues when you start planning and thinking about technology as a means to reduce social isolation and increasing community. There are real concerns in the community about security, security of personal information, privacy, security of other financial information is a real named barrier in most studies about why older adults are not adopting technology. And last, who's developing the technology, and are they changing the interfaces rapidly? What do I mean by changing the interfaces? What I mean is we've all had this wonderful experience of logging on to a favorite website or logging on to our email account, and darn it, everything's in a new place. I had my pacemaker installed in a major medical center 2.5 years ago on the day they changed to the Epic electronic health record. And I saw this firsthand about how when you completely change the interface, you scramble everybody's eggs until they learn the new one. And younger tech people are very, very frequently using the best and the brightest and the fastest, and yet without regard to whether or not older adult users are going to be able to pick up that interface more quickly. So the flip side, facilitators of technology use include developing peer-to-peer learning, making sure people with low income know what the programs are, both commercial and non-commercial, for providing financial support for internet access. We see a lot of programs. There's a program called PACE and others that offer people stripped down gear. And of course, there are right there in Orange County, there are organizations like GrandPad and others that have made small fortunes developing simpler stripped down gear. As a lot of technology can be worked on smartphones and cell phones as opposed to a desktop, and that seems to be a facilitator of technology use and limiting your updates. Let me mention last, there are some recycled old tech ideas that in this era of COVID are finding some utility. These include setting up phone trees as a way of people being in touch with one another. Yes, the phone. This is an old technology in which one person may call two, those two may call two others, but through some systematic way, either messages are transmitted or greetings are transmitted or people are in touch with one another to make sure they are safe or that their needs are necessarily being met. I'm a big believer, and they are super cheap in conference calls. In fact, one of the award-winning caregiver support intervention in Alzheimer's Europe 2 years ago was something that was basically called Wine at 5, in which the Alzheimer's Association of Portugal created a 5 o'clock conference call opportunity with toll-free number in a particular city for any caregiver to be able to call in, relax, put their feet up for 15 minutes and talk with other caregivers because they literally couldn't get out of the house to do so. I think this might be a wonderful technology, very low tech, but very high touch opportunity to think about in our COVID era. And we're even beginning to see the reintroduction of something from my youth, pen and paper. In fact, the joke in our family is cursive is grandma and grandpa's secret code, because neither of my grandchildren are being taught cursive in school. It's kind of special to be able to have a secret code, isn't it? Orange County is not rural, but I want to mention that these are resources about some inspiring ideas from rural. I did mention our Living Alone and Connected group. If somebody is interested in that, we've got the websites here and of course my references. So I'm gonna, let's see, disconnect the slides. How do I do that? I escape and I come back and here we are.
Wonderful.
Thank you, Patty, and I'll look in the chat for questions.
Yes, you can look in the chat for questions, and we'll save time at the end so that all those questions can be addressed. Thank you so much, Mike. That really helps us to frame the issues that really are so important for why we need to address social isolation. Coming up next is another long-term colleague and friend, Reverend Bill Hoy. He has served as a clinical professor of medical humanities at Baylor University for the past 12 years, and he also is the associate director of Baylor's very innovative medical humanities program that is currently equipping students for further training in order to be more compassionate physicians, allied health workers, and other healthcare professionals, in accordance with Baylor's mission of equipping women and men for worldwide service. Bill has more than 35 years experience at bedside with the dying and the bereaved, and for many years he's been a national speaker on both the national and international stage. And colleagues really have appreciated his very practical wisdom because it comes from very, very real experience with people in congregations, in hospice, and in bereavement care. And now he calls himself at the university an academic immigrant. In addition to his graduate and clinical education, Dr. Hoy holds the Fellow in Thanatology, which is the highest professional practice credential in the field of death and bereavement. He and his wife, Debbie, live in rural Texas. They have 2 adult children and a grandchild, and they're enjoying their empty nest in Central Texas. So welcome, Dr. Bill Hoy.
Well, thank you, Patty, and it's a delight to be with all of you today. I bet it's a more beautiful day in Orange County than it is here in Central Texas, but glad to be with you. And can my screen be seen?
Yes.
It is. Okay, perfect. I'm not familiar with this technology, so great. Well, what I'd like to spend some time doing today is talking with you a bit about the impact of non-death loss on and the gifts that technology might offer to us. Back in March, Helen Harris, a colleague of mine here at Baylor, and I authored a paper that we entitled The Unintended Consequences of COVID-19. We didn't realize we would turn out to be prophetic as we talked about things that we thought were going to be an issue for a matter of weeks or perhaps a couple of months that have now begun to enjoy a much fuller research and evidence base. But one of the things we did out of that was that she and I recruited some donors, and we delivered to a couple of the hospice programs here in Waco a handful of these Galaxy handheld tablets. I think we provided 6 of them altogether to hospice teams, sort of as a pilot project, just to find out if it would be helpful for them as their team was visiting, especially in skilled nursing facilities that were locked down, to kind of discover whether they were, whether it was helping to improve communication with family and some of those kinds of things. So that was essentially what we were trying to do, was to offer some perspective on that. As Mike offered the perspective on Putnam's bowling alone, the reality is that we are dealing today in a way that we never have before in any of our lifetimes, the nature of people who are experiencing a great deal of social isolation. And is not to be understood as synonymous in any way with loneliness. The evidence indicates, of course, that the widespread lockdowns that we've had, not only, of course, across the United States, but around the world, is significant, and I don't think anyone would agree with that. One of the things that Helen and I pointed out back on March the 21st, when we published the Unintended Consequences paper, was that our greatest concern as clinicians who have hung out on the behavioral medicine side of the aisle our greatest concern was the privileging of physical well-being over psychosocial and spiritual well-being. I see there's a word missing in my slide. It was the notion that above everything else, we must keep people physically safe and healthy, and that means free of disease, especially disease understood as COVID. What we predicted, and in fact what we are beginning to see the evidence of now, 7 months down the road, is that there would be a significant growth in complicated bereavement, not particularly because of the numbers of people dying from COVID, though I don't think anyone in March knew what that number was going to look like. Certainly the estimates then were much, much worse than they are today. And they certainly, though, everybody is seeing the upticks that we've seen over the recent days, but we're nowhere close, and probably I don't think there's a public health person in the world who believes that we're going to get anywhere close to the kinds of numbers we were talking about in February and March of perhaps as many as 2 million Americans dead was some of the early numbers coming from the CDC models and some of those kinds of things. And we're not going to see anything like that. So our concern then was, and honestly remains, how are we going to manage not so much the death from COVID loss, great as those are, but how are we going to deal with the ambiguous loss issues, the massive numbers of griefs of other kinds? And so really what I'm going to offer to you today is not a descriptive process at all, as much as what I'm going to try to do is offer some possible responses. And I have 4 of them that I'd like to offer to you. The first of those is to acknowledge and name ambiguous loss. There are many of those for people who are socially isolated, and that, as Mike has so eloquently explained, way over expressed among older adults who perhaps have mobility or transportation limitations, who frequently have loss of technology, or rather lack of technology, who are operating with perhaps lower access to resources financially, so that technological solutions that perhaps as a middle class working person, if I need a new router for my computer at home, I go to Office Depot and write a check for $60 and buy it. Or if I need a new computer, I swallow hard and spend $800 and buy one. That is not such an easy thing to do when one is living on a monthly income of $800 to $1,500 a month and trying to figure out how to eat and all of those other kinds of things. So these really are massive issues, and they are not simple issues. So those are some of the losses that people feel. One of the things, of course, that I've particularly noticed, because I teach college students, which are young adults, we're seeing an emerging amount of research now. Study from University of Georgia completed this summer is one. There are several. I mean, there's something coming out almost every day. But one of the things we're noticing, or I've noticed, and I'm seeing corroborated in the evidence now, and that is that older adults, more often than not, certainly the majority of older adults, while expressing some level of anxiety about getting sick, actually show considerably less anxiety than their young adult and middle-aged adult family members do. So what we have then, and I've seen this in in my own family, my 88-year-old mother-in-law is not particularly concerned about getting sick. And here in Texas, where it is where restaurants are open and things like that, she will frequently go to one of the restaurants that is open. She does her own grocery shopping and does those kinds of things herself, to the utter shall I say, panic of my wife's siblings, uh, probably because my wife has been married to me for so many years. My wife is of less concern about that, and actually said to her sisters rather recently, I'm much more concerned about protecting mother's dignity than I am her health right now. And if she gets sick, I will be sad, but I think I'm not going to be as sad with that as I will be with the kind of emotional crisis that we will cause, either removing her from her own home, taking away her car keys, or doing some of those other things that she is quite capable of determining on herself. And so you can probably tell a little bit about the direction that goes in our family, but I see that kind of across the board. So what I guess I'm really trying to say is these ambiguous losses are often very, very difficult to name and label. And one of the things I find really helpful is to flat out ask, what are the things you're missing right now? What are the things you've really lost? What are the things that you wish could be returned? What are the experiences that don't involve anybody dying? What are the experiences you're grieving, though? What are the things that make you sad, that make you low? Those kinds of things will often lead to descriptions of ambiguous losses. And in those interactions, whether we have them on a phone, via a Zoom call, or in places where it is appropriate and where we can maintain some distance, is to have those conversations face to face. A colleague of mine practices for the Baylor Scott and White Health System as a psychotherapist, and he and I had breakfast together this morning, which tells you some of the openness we have in Texas that I know is not always done elsewhere. But when he and I were having breakfast together this morning, he was telling me that now in his clinic office, which much like my office, my chairs are about 8 or 9 feet apart in my office, and it's very easy for me to have a student or a patient in a chair across the room from where I am. And Lewis is seeing patients face to face, and he talks about the patients now who have come back to clinic after having been on Zoom, how much they indicate to him they appreciate the value of being able to be face to face again. So that's what I'm talking about. To name those kind of ambiguous losses can be huge. One of the things I believe that's particularly important about that, and that makes this particularly ambiguous, is the notion that at the very beginning we thought this would be short-lived, and now it's very evident that it's not. And so one of the ambiguous losses that we often have, when somebody dies, I know they died, and now I can begin rebuilding my life from that date, that fixed moment in time that I know. When a loss is ambiguous, there's no time frame on it. I don't know how long this is going to go on, and that, of course, is another of these ambiguous losses with which we're grappling. A second response I think that we need to be making is to utilize technology while appreciating technology's limits. I love this photograph that comes from the Hebrew home at Riverdale in New Jersey of Mrs. Winehouse as she interacts with her daughter via FaceTime. And I think this is an incredibly useful tool that we are seeing used in especially in some congregate living facilities where staff can assist older adults who may not be tech savvy to get online and have a call or a conversation with their kids. And it is, of course, 1,000 times better than having nothing at all. And being able to see a face is often a whole lot better than just hearing a voice via the phone, even if I have a phone accessible. But I think it is equally important that we understand the limits of such kinds of things. Mike talked about barriers a while ago, and a barrier that I would add to the list that is of grave concern to me when we assume, and I think the younger a caregiver is, the more likely she or he is to assume that technology will solve all of our problems here. And what I would like to remind us of, although we all take care of older adults, so we might not need reminding of this, but that is that according to the National Institutes of Health, the most recent NIH data that I saw, more than 50% of adults over the age of 75 have disabling hearing loss, and more than 15% of adults over the age of 75 live with significant vision impairment. And technology becomes particularly challenging for folks that live with one or both of these impairments. And they are overwhelmingly going to be living in environments where they may be locked down and unable to have visitors face to face. My wife has a 92-year-old aunt who is living in a retirement community in suburban Dallas, and the policy of that community is there is no family in or out. And in fact, my wife's 92-year-old aunt has not had a human contact except when she had a fall and had to be taken to the hospital in the midsummer and spent 3 days in the hospital. She has not had the touch of another human being since March. Her meals are delivered to her apartment. She's living in an independent living apartment. They are delivered to her apartment, and after the attendant leaves the door, Elaine is able to open the door and retrieve her meal, and then put her tray back outside afterwards. In her case, fortunately, she hasn't any hearing or vision impairment, and she's quite tech savvy. She does email quicker than I do, but she would be a notable exception. So I think it's very, very important that we remember that. And then, of course, my friend Lewis, the psychotherapist, clinical psychologist reminded me this morning that we quickly have thought that telehealth, whether that's behavioral health or physical health, is the panacea end all to this whole question. And he reminded me that it is absolutely impossible to assure confidentiality, and that frequently he has been on what would be tantamount to a web call or a Zoom call with a patient of his, dealing with some very, very troubling family issue, and someone he sees walks through the door behind his patient and of course confidentiality is immediately lost. And so I guess what I'm trying to suggest here is that we remember that technology can be very helpful, but I think it probably behooves those of us who are fairly tech savvy to always be thinking about what is it like for the other who isn't as tech savvy as I am. My third response is to inquire about regret. Whether we are doing this by Zoom or WebEx, whether we're doing this in a FaceTime visit or in a phone call, I think we want to allow our patients, our clients, our constituents to give voice to what it is they regret about the current circumstances, how they wish things could be different. I think sometimes in our haste to try to remain positive and upbeat and all of those kinds of things, we might be inclined to rush headlong into let's keep everything positive on the up and up. Unfortunately, what that does is that draws the anxiety and the unexpressed depressive experiences down and inward, and instead of being expressed where they can actually be labeled, identified, and perhaps together, a clinician and client, clinician and patient can collaboratively solve the problem. Instead, we have the sort of the buried notion, or the proverbial horse in the middle of the dining room table that nobody talks about. So I've been asking lots of folks in my work here of recent, especially older adults with whom I visit, um, what do you wish would be different right now? Every time I talk to Aunt Elaine, which I call her too, I ask her again, so what do you wish were different? And how do you long for things to be? And how would you rewrite the script if you could? And even though many of the things with which we contend are as a result of governmental regulation, there isn't any reason that we ought not be engaging people with how they wish things could be different, because that's very, very powerful, very empowering, and certainly leads to an increased level of self-efficacy. And then my final response is that we offer adaptation when possible. This photo from the Cathedral of the Angels, Our Lady of the Angels, up in downtown Los Angeles, of parishioners attending Mass, socially distant, except those who, of course, live in the same household. This might be if you're attending worship in a community. In your own faith community, it might be similar to what you would see if you're going. Again, I've been really interested. My wife and I attend a rural church here near our home, and every other pew is blocked off, and families are encouraged to sit together, but to not sit closely on the same pew with other families. Though we don't have the mask police at the door, I've found that individuals coming into church, they wear a mask as they're asked to, and they keep it on until they're seated, and those kinds of things. So we've done a number of adaptations, and at the same time, our service is broadcast over, I don't know, FaceTime or one of Facebook Live, or I don't know, another, some technology platform. And about half, I would guess, of our congregation, certainly not all of our older members, but many of them, have chosen to watch services from home. And I'm particularly delighted because Alzheimer's Orange County, knowing that this is a real issue. And some of you may not even know this, but for many years now, Alzheimer's Orange County has had a series of adaptive worship services in congregations of various denominations and faith traditions around Orange County, held, at off times from whatever the regular, perhaps weekend worship time would be in that congregation. And these adaptive worship experiences are designed for people who have cognitive impairment to attend with their principal caregiver, and it can be a very, very meaningful time. Well, of course, COVID has made it impossible to do those things face to face in Orange County. So Alzheimer's Orange County has now worked with a number of congregations, and they're in the process of video recording 3 adaptive worship services in 3 different congregations right now that will go live via the Orange County website, probably through YouTube or one of those channels here in likely just the next couple of weeks. With a goal to have around 20 congregations altogether doing that by the end of the year, the first of the year. I think that's an incredible example of the kinds of adaptive possibilities that we have in front of us. I don't want to in any way suggest that technology does not have a place. I think it has a very, very important place in supporting people, especially with the kind of social isolation that we've seen. The caution that I hold out, and this is really the caution that I hold out to probably mostly people who are younger than my 6 decades, but that is to not see technology as anything more than a tool that sometimes works and sometimes doesn't work, that sometimes is useful and often is not particularly useful, and to make sure that we are doing the kinds of things that actually engage people while also understanding the very real sense of loss that they experience, and that those losses transcend death losses and go certainly well beyond them. So I am delighted. I'll be around at the end when the Q&A time comes. I didn't put my email address in the handout, but I'm simply Bill_Hoy at Baylor.edu. If anybody has a question that we either don't get to today, or there's something that I can do to clarify. But again, I'm honored to be with all of you, and thank you, Patty, for the invitation, and thank you for the very, very fine work, all of you, both who are presenting, but especially the 68 of those of you who are online with us right now are doing, and the very important work you're doing to take care of folks during what is a very challenging time in world history. Thank you.
Thank you, Bill and Mike. Good stuff, and we're continuing now. It's my privilege and pleasure to introduce to you Amber Carroll, who is the director of COVIA's Well Connected, and that they aim to decrease loneliness and increase social connections for older adults across the country. Before joining COVIA, Amber led the San Francisco Transitional Care Program, which is a CMS demonstration project, and it successfully decreased hospital readmissions for Medicare recipients. Her career in aging services began at the San Francisco Aging and Disability Research Center, providing information, referral, and assistance to nearly 10,000 seniors and adults with disabilities every year. Amber is a licensed marriage and family therapist and also holds an MA in counseling psychology from the University of San Francisco. Amber, thank you for joining us.
Thank you so much. And a quick question, because I am also not great at this technology. Can you see my screen?
Yes.
Okay. I've got the two screen thing, so I always get a little confused. Well, thank you so much for inviting me here today. I'm thrilled to be here with the rest of the panelists and all of you in attendance. And I'm here to talk about what's new in technology. So excuse me, for those of you who have been in this field for a while, hang on just a second, I'm sorry. Let me get my slides going here. Oh no. There we go. All right. So yeah, thank you so much for inviting me here today. And I'm part of an organization called COVIA. We are based in Northern California and predominantly play in the arena of senior housing, but we also have a lot of really robust community services. For those of us who are in this field, and I imagine everyone on the call is in fact in this field, this idea of technology or this idea about connecting people isn't a new thing, but I don't think any of us ever could have expected that we're in this crazy global predicament that we're in right now. So today I'm going to be talking about some solutions to technology, and as most of our panelists have mentioned, you know, technology really does need to be used as a tool. And I think what technology companies are selling us right now is that technology is sort of the be all and the end all of social connection, especially during this time of COVID. As Bill just said, you know, technology sometimes works and sometimes it doesn't. And I'm here to attest to that as I tell you about some virtual programs. So as you see on the screen, this is all stuff we talked about, and this is all stuff that you guys know. And we've been learning about the connection and the negative health impacts, and that's both physical health and mental health outcomes that are associated with loneliness and social isolation. So this here is just a snapshot, right? But there's one thing during COVID that we've learned, and that things actually seem to be getting worse in this arena. So when shelter-in-place orders hit San Francisco in March, COVIA joined UCSF and others to delve into the effects of COVID during this unique time in history. And obviously, this research is ongoing because we're still in the thick of all of this. But preliminary results were recently published, and they found that 54% of older adults surveyed reported feeling more lonely during the pandemic. One 64-year-old woman said, "This has been the hardest thing I've had to do in my entire life. The isolation has made my mental and physical health worse." Now, this will be really interesting to see how these results play out, because some of the other preliminary studies actually said that some people who were profoundly isolated before were finding a little bit more connection because more organizations and programs were reaching out to them during this time. But overall, we're seeing that people are feeling this worse. But I'd like to be done talking about all the doom and the gloom of loneliness and social isolation. I've been trying to kind of shift that conversation for a long time. And instead, let's talk about some creative solutions to that. So I'm here today to tell you about some virtual connection opportunities that are available to older adults living anywhere in the United States. And these programs include Well Connected Espanol, and Social Call. Now, Mike mentioned the options of some cheap new solutions that might kind of bridge on some old technology revamped. Well, these solutions that I'm going to tell you about are one better than that. They are free and they do utilize all kinds of technology. So first I'm going to talk about Well Connected. And this is actually two programs, the same program model. As you might expect, Well Connected is in English, and Well Connected Espanol is a program entirely in Spanish. So these programs provide virtual opportunities for older adults to both participate and to volunteer. They're designed by and for the community of older adults that we serve, and they are totally free to individual participants. So, and the other thing, as we are talking about technology, everything we do here on Well Connected and Well Connected Espanol is accessible by phone and online. So wherever you're most comfortable. So this is an example of the Well Connected calendar. As I said, everything we do is accessible by phone, but there's a few things I want to point out, because when I explain this program, people often don't quite get it in their heads as to what it looks like. So here's a visual of what it looks like. A couple of things to point out. One, I want you to notice that this is a 7-day-a-week calendar. So even when organizations were able to provide live and in-person programming, there often just wasn't much to do in the evenings or stuff to do on the weekends. And this goes for senior housing communities and senior centers and libraries and kind of all the places that people tend to convene. So I mentioned that these programs are designed by and for older adults. And this really speaks to how that shows up in our curriculum. So when you look at all of these things going on 7 days a week on the Well Connected program, about 80% of this content is borne by our participant population. So when I said that we're looking for people to both volunteer and to participate in the program, that's where you're seeing that. So one of our facilitators and participants, Janice, told us that she got bored over the weekends because there wasn't stuff going on. So she developed her own programming. She developed bingo, beginning bingo and advanced bingo, a program called Where Were You When, which really elicits memories to talk about points in time in people's lives to share that. She developed a program called Inspiring Stories, because I think we can all attest to the fact that the world's kind of stressful right now, and it's sort of nice to take a little distraction and talk about inspiring things that are happening simultaneously with all the craziness. So these programs really provide purpose and connection for not only the participants of the program, but also the facilitators. Both Well-Connected and Well-Connected Español provide programming 365 days a year. So if somebody's feeling lonely on Thanksgiving, and we know that the holidays can trigger those kinds of feelings exponentially more than on other days, this Thanksgiving, Well-Connected will be hosting nearly 6 hours of live interactive programming for people to join into a community of other people. I'd also like to point out that some of these groups are listed in red, and those are the groups that we call our lifelong learning groups. And these groups we make available to communities for a subscription to join in as a live activity. And this has been really especially welcome during COVID, because especially housing communities can't bring people in to provide the live programming that they were once accustomed to doing. These groups tend to be more presentation based, and these groups tend to be led a lot more by professionals. So these include armchair travel, health and wellness. St. Joe's has done a lot of our health and wellness presentations over the last couple of years that we've been partnering with them. Museums at Home, where we partner with museums all around the country to do docent tours. Open Studios, we bring professional artists to the table to talk about their work. And Tech and Culture, which is kind of a mishmash of all things technology and culture related. So these we open up to not only individuals in their homes, but also to groups of people. Next session, we're really excited. I'm getting together my winter session that starts on January 1st, and we're adding another another lifelong learning program. And also, I should say, those are the ones available in English, and in Spanish, we have Armchair Travel and Health and Wellness as well. And I just want to show you the Español calendar. This is a little bit of a smaller program. Well-Connected has been going on since 2004. So we've been doing virtual programming since long before the pandemic ever hit. And we really did it as a way to connect individuals who simply weren't able to get out as much as they were once accustomed, or for folks who didn't have stuff to do in the evenings and the weekends and were still interested in more social engagement. So we received funding in 2019 to start the Well-Connected Español program. It is rapidly growing. In fact, since we launched last April of 2019, the program has grown by an average of about 40% every single session, and both programs are offered on a trimester basis. So those are the actual Well-Connected programs, and like I said, free of charge, open to everybody who's over the age of 60 living in the United States who speaks English or Spanish. Now, we heard a lot from the previous speakers talking about these barriers to technology. Mike, you mentioned something about old tech having some legs, and I love that. I'm going to quote you on that. It would be remiss to talk about technology in regards to programming for older adults without addressing accessibility. So now that the entire world has been forced to move live programming to virtual platforms, many organizations serving older adults are sadly leaving a huge percentage of those people behind. I just did a poll of aging service providers, and I found that 73% of organizations providing programs to older adults went ahead and created their own programming, and only 34% of those organizations actually reached out to programs like us that have been in existence and know how to do this really well. So I want to encourage folks to utilize us in addition to the great programs that you're hosting. The other thing was 80% of those organizations that went to virtual programming chose Zoom as the platform. Now, Zoom is great. We use Zoom for some of our things. But here's the thing, when we talk about accessibility, for somebody calling in from that avocado green telephone hanging on their kitchen wall, and we all work with people who have that telephone hanging on their kitchen wall, they need to press 24 digits to enter a Zoom program. And now there's new security and passwords, and if organizations use those for security feature, that's 30 digits that you have to type into your phone. So first of all, you can't do that with a dial phone. And second of all, imagine doing that if you have any kind of tremors or vision loss or memory loss or any other kind of cognitive decline. Really a challenge. So a lot of these organizations that are saying, hey, just jump on Zoom for that Zumba class you usually do, are just not getting the same numbers that they're seeing live. And that can be for any number of issues that we've talked about, whether that be disability, financial, interest, whatever it is. So Well-Connected and Well-Connected Espanol really aim to reach every older adult who speaks English or Spanish, and will have the ability in the future to even expand that further. What we needed was an accessible conferencing solution, and we've been trying to find that accessible conferencing solution since 2004. We started as a telephonic program. We have slowly moved into some more video content as well. Shocking, in 2020, this accessible conferencing solution just doesn't exist. So for the last few years, Covea has been building our own conferencing solution, and it's really to meet the accessibility needs of all older adults. We're currently using it for about 90% of all of our programming. And when we complete the platform, we're going to be totally accessible to older adults, including those with vision loss, hearing loss, memory loss, mobility impairments, any kind of technological impairments, and people who speak languages other than English. For the Well-Connected Espanol program, everything that people are seeing on screen and everything that they're hearing on the phone is in Spanish. And that's another thing that just doesn't exist with any off-the-shelf solutions right now. So we're really excited about this as we move forward, because we want to really remove any barriers for entry for people to join into a virtual community. And I do just want to stress that community piece to that. For any of you on the call, I absolutely invite you to join one of our programs to understand that this really is a community, like if you went into a housing community or a senior center where people know each other, enjoy each other, respect each other. And one of the things that it does really nicely is it represents diversity, unlike any diversity I've ever seen in the real world, because people are convening around a mutual interest in a topic. And so we might have somebody living in a penthouse apartment in Central Park in New York. We might have somebody living in an SRO in the Tenderloin, and we might have somebody joining us from rural Alabama. And they're all joining because, you know what, they really love Frida Kahlo, and they're joining that Museums at Home to learn more about her. So, so that's the Well-Connected and Well-Connected Espanol programs. When I talk about our accessible technology, it's called Agora. And like I said, there's just some really nice features. We can call people into groups, which is really great for people with any kind of memory loss. We have name recognition because we register people for programs. So if somebody wanted to join us for a program, they're going to get a phone call at that time, welcoming them by name into the program with the program title as well. We're building out screen reader accessibility. We're building out closed captioning. So really making some efforts to make it accessible to everybody. So that is the Well-Connected programs, or those are the Well-Connected programs. And I want to just touch on our sister program at Covea, which is called Social Call. And Carl talked earlier about friendly visiting programs, so you are all very well aware of this. Just to let you know that our social call program started as a traditional friendly visiting program, but after we kept hearing from a national audience of well-connected participants, we realized there was real power in offering social call virtually as well. So social call matches individuals for one-on-one phone conversations throughout the United States. The really cool thing about the virtual matching as opposed to the live in-person matching, which we still do, not in COVID, but generally we do in a few counties in Northern California, is we can do something that they call prescriptive matching. So you're not bound by technology, or excuse me, by transportation or by geography. You're really matching people based on mutual interests. And all of our programs are really trying to level the playing field and become really more equitable. So we don't call our participants clients, because our participants are also our volunteers. With social call, you might have somebody receiving a call, but they might also be giving a call to somebody else. So we're really, I think it was Mike who mentioned John Cacioppo, and he had this whole theory about the reciprocal bond, and that's really the magic of the Well-Connected and social call programs, is we're really leveraging that reciprocal bond. So kind of lastly, this is a little shameless promotion, but many of you have heard of Dr. Carla Parasinotto. She did a clinical study on loneliness and social isolation amongst older adults back in 2012. Dr. Parasinotto has been a fierce advocate in the field of geriatrics, and really pushing healthcare entities to assess loneliness and social isolation. And as we talked about before, this medical focus of everything to really broaden what we're looking at in terms of health. And that involves all of this stuff that we're talking about today. So, we've been working with Dr. Parasinotto. We're involved in a current study. We're involved with a COVID study with her. But what we're really looking to do is find out, not only are these programs, are they actually addressing, are they shifting that needle around people's feelings of loneliness and their experience of social isolation, but are we also increasing positive and meaningful social connection? So our research project right now is really assessing both of those things. And one of the interesting things we found during COVID is that people are saying, wow, I feel more lonely, but man, I have so many more connections than I've had before, and that's really important to me. And I think that's interesting to look at and see that positive spin of things too, because I think that positive social connections might lead to positive health outcomes as well. So someone asked about the COVIA connection programs. Here's what Dr. Parasinotto had to say. I've had great experiences working with Well-Connected Espanol, and social call. From referring my own patients to volunteering for programs to program evaluation, I've seen firsthand what these programs can do to address feelings of loneliness. And Dr. Parasinotto actually prescribes these programs to patients when they're coming in, and she does do that assessment to find out that they are really experiencing a lot of loneliness. So, so these are the programs, and I'd like to call them solutions. Again, I just want to sort of reiterate this idea that technology is such an amazing tool. It is wonky. It has a lot of foibles all the time. But when people can't get out and people can't connect, this really provides a wonderful opportunity for folks to engage with each other, create friendships, and create these really meaningful relationships with each other. And with that, this is my contact information, and I too will be sticking around if anyone has any questions. So thank you so much.
Thank you so much. Excuse me. Thank you so much, Amber. This is such good stuff. We've just heard a great deal about all kinds of things related to technology. I couldn't agree more with technology is a tool, not the tool. I'm paraphrasing, but it has its limits, it has its benefits, and like all tools, I think it works best when it's used appropriately. And that we're gonna just segue to that now. At the Orange County Strategic Plan for Aging Technology Committee, we have talked about technology implementation. One of the things that has come up is the fact that, and this is an editorial comment, I think, I don't want to put words in the committee's mouth, but I think we are all coming around to knowing that it's a three-legged stool at its most basic point. You have to have hardware and software if you're going to use technology that's appropriate to as the tool, appropriate to what you're trying to do. You also have to have bandwidth and connectivity on both ends. It doesn't do any good if one end is fast and one end is slow. And then you also have to have the user on each end know how to appropriately use the technology. And yes, there's a lot of barriers and everything, but whatever modality you're using, the user on either end of that connection, either end of that service that's being provided must use that. One of the things that came up in our conversations and our discussions and meetings was, who doesn't have this stuff? It's great to provide services and whatnot using technology for folks, but they kind of have to have all three legs of that stool. Fortunately, in our county, in Orange County, we've had 3 different entities conduct technology surveys and asking questions around what I just described, and asking them a lot more eloquently than I just described them. But what we are going to hear now is from each of the 3 organizations. We have 3 people on the panel. They're each going to talk for 2 or 3 minutes about the survey that their organization conducted. We're then going to have a little back and forth discussion among the panelists. And then, as with all these other panel or presentations you've heard today, we will have time for Q&A, and I will encourage people to put their questions in the questions section of the control panel. So our first presenter is Nikki Barrett. Nikki is the social work supervisor at Alzheimer's OC, and she's a licensed clinical social worker. She has a master's degree in social welfare and a Bachelor of Arts in psychology with a social work minor. Before coming to Alzheimer's OC, Ms. Barrett was a care planner for Independence at Home, a program at SCAN Health Plan, and a care manager for the City of Irvine Senior Services, and a resident services coordinator for Jewish Federation and Family Services in Irvine. Ms. Barrett is passionate about assisting older adults and with care coordination, and particularly for special populations impacted by dementia. So without further ado, I'll turn it over to you, Nikki.
Thank you so much, Ed, and thank you everyone for being here with us this afternoon. So the Orange County Strategic Plan for Aging Social Engagement Committee created a technology survey earlier this fall, and we had 10 questions. If we could go on to the next slide, thank you. 10 questions that were exploring some of these themes, so device and internet accessibility, current utilization of technology, including motivators and barriers, as well as confidence and comfort levels and areas of interest in technology application. The survey was open for 30 days to the public through SurveyMonkey, and additional responses were collected by some of our committee members, including St. Jude, Laguna Woods Village, and Council on Aging. And those responses were collected manually and then transferred into the SurveyMonkey database. We promoted via social media as well as with key network contacts in the senior service industry, and we closed the survey with 113 responses. So some of the highlights that I will go over briefly today, we did ask a question about, first and foremost, what type of devices individuals are utilizing. And as you can see, the majority do own and utilize smartphones, followed by laptops more commonly, and then tablets and desktop computers. We did have one individual who had indicated not having access to any device. As far as device features, the majority of our respondents did indicate that they at least had access to microphone, speaker, and camera, and then a little bit less for internet access, application compatibility, and adequate memory space. And a few of the individuals were not entirely sure if their devices supported these features. And as far as current usage of smart devices and technology, we wanted to get an idea of what people are doing day to day. And so sending and receiving email followed by video conferencing with loved ones were the most common. And then, as you can see, several other activities listed here. And it was interesting to note that, of course, a few individuals, they were not interested in using their internet devices if it couldn't be helped for some of these activities. When we were looking at comfort level and confidence level utilizing technology and navigating smart devices and virtual platforms such as Zoom, we wanted to know how people felt about this. And so a good number of our respondents did either agree or strongly agree, but there were also individuals who felt that they were not comfortable and confident utilizing these devices and platforms. The majority of our respondents also indicated feeling that smart devices are personally essential, and it's not clear whether this would necessarily be different were it not for COVID, but as you can see, 72% had answered that they felt that it was essential. And that said, it was also indicated that feeling more comfortable and confident, as well as having access to training, would help with utilizing technology even more. And so as you can see, at least half of the respondents felt that having access to training would help in terms of motivation for increased utilization. And then 68% of the respondents felt, if that they could only feel more comfortable and confident in knowing how to use these devices, they would probably use it more. And as far as when we asked about areas of ongoing or future interest in utilizing smart devices, there was a wide variety of responses for many different activities. The most common one being, talking with family and friends, so connecting with loved ones, followed by health and fitness activities and a wide variety of other things. And there were a good number of individuals who did indicate that they would prefer to attend in-person activities. But as you can see, there's a good level of interest for a lot of different items here. As far as some considerations, it is of course worth noting that the majority of our respondents did directly participate via SurveyMonkey, which implies that, of course, they have internet and smart device access to begin with. Additionally, not all questions were answered by every respondent, so the percentages you see there are variable. The opportunities for virtual offerings do open up a lot of possibilities. Personally, at Alzheimer's Orange County this year, we have a number of social work interns who are creating Zoom group activities and a wide variety of content for seniors and caregivers. And they're modifying that content so that participants can of course, join via Zoom with video and audio if they can, but they can also dial in via telephone if they don't have access to Zoom, or if they would prefer not to. And last but not least, there is the unsurprising but ever-pressing need for technology training and tutoring to be successfully delivered somehow virtually or telephonically while in-person training is on hold. And I believe we'll be going to Elizabeth next. Thank you.
Nikki, thank you so much. And yes, next we are going to hear from Elizabeth Freyer. Elizabeth is an administrative manager for Orange County's Office on Aging, and she's been there for about 2 years. She's been with the County of Orange for about 10 years. She currently oversees the transportation, in-home services, case management, and elderly nutrition programs. And if that's not enough, she also manages all data-related matters for the Office on Aging. Prior to Office on Aging, she worked for the Orange County Sheriff's Department and the Orange County Social Services Agency. And Elizabeth holds a bachelor's degree in psychology from Cal State Fullerton. Elizabeth, it's all yours.
Thank you, Ed, and hello, everyone. It's an honor to be here today and share with you our most recent technology survey. So we'll go straight into it, our survey overview. Thanks. This survey was put together by the Senior Citizens Advisory Council Technology Committee. And they wanted to find out Orange County older adults' knowledge, accessibility, dependency, and technology. We provided this survey via SurveyMonkey, and we also handed out hard copies. Our home delivery meal drivers delivered these copies to our home delivered meal participants. The survey was in English only, and there were 9 questions. 3 questions were participant demographic questions, and 6 were technology-related questions. We had approximately 552 total respondents. We collected 542 hard copies and only 10 online surveys. All participants were home delivered meal clients, and most respondents were 85 years of age or older, which makes approximately 38% of the survey respondents. 31% were 75 to 84. 28% were 60 to 74, and we had 1 participant under the age of 60. 12% of respondents were Hispanic Latino. Most respondents were white or Caucasian, and all respondents reside in Orange County. So now transitioning into the technology questions. Participants were asked if they have internet access at home. 35.7% said no, and 62.5% said yes. And doing a little bit more filtering in our results, I found out that those who responded with not having internet access at home were primarily 85 years of age or older. Question number 2, participants were asked which of the listed devices did they use regularly. Please note that this question, participants were given the option to choose multiple responses with this question. So the survey showed that most of our respondents, 38.9%, regularly use a smartphone, followed by a computer. Question number 3, participants were asked what they consider to be their general computer skill. 49.5% of participants said their general computer skill is low, followed by moderate and then expert. Most respondents considered their computer skills to be a low level, which I kind of expected with our home delivered meal participants. Question number 4, participants were asked what they use their computers for. And it was interesting to see that most of our participants, 42%, use computer to communicate with their family and friends, followed by 35.7% of respondents who use their computer for researching. 27.5% use the computer for shopping, and then so on and so forth, such as paying bills, and you can see the results there. Paying bills, 25.2, online banking, 23.7, doctor appointments, social networking, navigating, and other. For question number 5, participants were asked if they visit facility providing senior services. 77.2% said no, they don't participate in a facility providing senior services, and that's mostly, it's kind of expected because we do have to take in consideration that most of our respondents were home delivered meal clients, which are usually over the age of 60 and homebound. So 77.2% said no, and 19% said yes. For the last question, My reaction to this one was, wow. And then my next question was, why? So respondents were asked, would you be interested in learning simple tasks on a device? 51% of respondents said no, and then 41% said yes. So I said wow to the 51% of respondents who do not want to learn simple tasks on a device. And I asked myself why. And just, you know, thinking about it and thinking of the different barriers that I think it was Mike mentioned. He said that there are different barriers to technology, and one of the barriers that I think it's very important to consider would be your feelings towards learning something new. I know in the past when I've learned something new, you know, there's a deal of frustration. There's a sense of being lost, and a sense of feeling like you're being a burden to that person who's training you. So if we're feeling these things, then why even put ourselves in that situation? So that was kind of me just thinking a little bit into this question, and looking at the 51% of respondents who said no, they are not interested in learning simple tasks on the device. So yeah, with that being said, those were all of our questions, and thank you for the opportunity, and I'll be sticking by for the Q&A.
Thank you so much, Elizabeth. And this is very interesting. I hope you all feel the same way. And it's going to get more interesting because now we're going to hear from Nadia Babai, who is Executive Director of Laguna Beach Seniors. And she's got a whole host of credentials. She's been at this for 40 years. She's been involved in corporate, nonprofit, and government jobs. Before coming to Laguna Beach Seniors, she managed the U.S. Commerce Department census for 12 cities in South Orange County. She also served as development director for Stopgap, which is an educational nonprofit theater group, which was way ahead of its time. She previously worked as a structural engineer, designing commercial buildings in Orange County. And she took all that and her passion for community work, and she's received quite a bit of recognition. She was Irvine Citizen of the Year in 2005. She's been recognized by the state legislature, and we're fortunate to have her in Laguna Beach, and she's going to tell us a little bit about their survey, which they conducted recently. Please take it away, Nadia.
Thank you, Ed, and hello, everyone. I want to thank you for the opportunity to share our technology survey results with you. You know, like many other organizations affected by the pandemic, back in March of 2020, out of caution and based on the warnings, you know, that were issued by California Department of Public Health, our organization announced that we'll be canceling our programs and activities at the Suzy Q Senior Center in Laguna Beach until later notice. And then we had to close our senior center. So within a 2 weeks period, we had to do some quick crisis management, and we decided to offer our programs online via Zoom. So we were successful in bringing at least 2/3 of our clients back to taking classes, and we were also able to teach people how to use Zoom. A little later in June, we were interested in identifying the technology that people use and the gaps that may exist. So therefore, we decided to do a simple survey with 10 questions only, both online and in paper versions. And through that, we wanted to learn, you know, where seniors were in terms of their utilization of technology, you know, their interest in having technology they don't currently own, and if they need to be connected, what devices they need. So what we, you know, what the survey results, when the survey results came in, you know, after it was deployed to over, you know, 3,000 people, we noticed that there was like 36% open rate, over 1,200 opened the survey, and which resulted in 311 people responding to the online survey. Additionally, we gathered some surveys, results from people who use the paper version. Let's go to the next slide. I have a lot of slides, so I've only requested 3 or 4 to be shown. So some of our findings was that 85% of the respondents felt comfortable using the technology, which was really good news to us. 83% of seniors consider their general computer skill level to be moderate to expert. 98% of people, use their device to access emails. And 2 of the most popular devices were smartphones and tablets. And really, this last one is good news that 50% of people had already experienced a telehealth doctor's appointment, which was good news to us. So question number 10 for us was interesting because, we wanted to make sure that it's an open-ended question because we were, trying to find some additional comments. And we received 91 individual responses that, with additional suggestions for programming ideas. And people, thanked us for our tech support Zoom workshops. They also reached out to us for assistance. For example, someone who didn't have a smartphone, just had a flip phone. They were wondering how much it cost to buy one. And they also let us know that they prefer to attend in-person, classes at the Suzy Q rather than, Zoom. Of course, the survey helped us learn about the seniors' needs. Those who responded to the paper survey let us know that they needed a device to be connected, but could not afford to pay for one. So what we did to help that situation, with the help of one of our funders, we were able to purchase 14 iPads and equip the seniors with technology that guaranteed some socialization during the pandemic. We also paid for some of their internet connections. Altogether, the survey was very important to gain knowledge of one, identifying the technology that people use, and 2, identifying the gaps that existed. We're glad yet we were able to break the cycle of isolation for many seniors by equipping them with technology that support their social connection. So they are now able to attend our program offerings via Zoom. And by the way, we offer over 45 programs via Zoom, which are extremely popular. During the last quarter only, over 4,000 people attended our online offerings. And they were not only from Laguna Beach and Orange County, but they were also from all over California, all over the United States, and through the word of mouth, some people actually from Europe, attended our programs, which is all good news. So, just wanted to let you know that this was a very educational survey, that we based a lot of our activities based on the surveys that we do, and happy that are able to offer so many programs. So if you wish to visit our website, just Google Laguna Beach Seniors or go to the suzyq.org. You will see a whole array of programs that are offered and extremely popular. This concludes my quick presentation. I'm happy to answer any questions that you may have.
Thank you, Nadia, and thanks to Nikki and Elizabeth as well. We have a few minutes in this block of time for the 3 of you to maybe interact with one another. Patty, unless we're gonna just segue straight to we have a little time. I'm curious, and I've got some thoughts of my own, but I'm curious what each of you think about the other 2 surveys that you heard, because there were some things in common and some things that were different, and there were different geographies, there were different populations. But what do you all think? I'll put you on the spot, Nikki, since you're in the box next to me on the upper side, so I randomly pick you first. You have any thoughts after hearing from the other two about these surveys and what they might tell us?
Yes, I was also struck, Elizabeth, by that one question about people's willingness to learn the simple, basic. So, I mean, I think, it's there's no cookie cutter approach, I think, is what we're all clearly seeing when it comes to technology application and, interventions to support seniors. And I think being understanding of, their personal preferences, but it is also, I think, there's a level of concern for social service providers when we're wanting to address social isolation, knowing, how harmful that it can be. But I think that everyone has various preferences, and it's just interesting to see the variety of responses, even with somewhat similar questions across the board.
Well put. Elizabeth, what do you think? Anything to add?
Right. Yeah, that was I'm glad that question was asked. I wasn't expecting it to go that way, especially now in this COVID world. It's good to note that this survey was distributed in February, right before COVID, and it was collected in, I believe, early May. So I don't know if the results would change if we were to ask that same question again. I would be very interested to see that. But, it is a learning curve, and with any learning curve, there's, difficulties, there's emotions, and yeah, it was a very interesting result on that.
Thank you, Nadia.
I also,
oh, sorry, go ahead.
Sorry, Nikki, I thought it was very interesting to see that most of your respondents were online. I'm curious to see how or where was it distributed to get that response?
Yeah, so we did plug it in on our website and then, across social media platforms. I think a huge part of this was Patty had pushed it out to also a lot of key contacts who then pushed it out to their constituents. And so there was probably a pretty large footprint as far as sharing it via email, online. And so I think that's also why we got the majority of our responses via, the direct Survey Monkey link. And we left it up for as long as we could, about a good month. So I think that was also helpful.
Excellent. Nadia, do you have any quick thoughts on what you heard from the other two? Because then we have a question from one of our participants directed at you. So I'll start with.
Yes, just quickly, I also noticed that, some of the questions, well over 30% of people, were still interested in in-person socialization, meaning going to the senior centers, socializing with their friends and people that they used to see every day. But things are changing, to a point that here in Laguna Beach seniors, we have decided that once the pandemic is over, we will not only offer in-person activities and classes, but also continue our Zoom offerings. And I'm pretty sure other organizations feel the same.
I think personally, we're hearing that a lot, that there's not really going back to January, but there's also no substitute for some people for face-to-face. And I think using the correct tool, as we've heard, sometimes it's face-to-face, sometimes it's virtual, sometimes it's one-on-one, sometimes it's one-to-many. It's another set of tools in the toolbox that a lot of people have learned how to use. Pardon me for pontificating about that, but I couldn't help myself. Nadia, a question came in asking if any of the people completing your survey received Meals on Wheels or might be considered homebound at the time they completed the survey, or were they more what you would call active adults?
We have over 5,000 people in our database, and slightly over 3,000 have provided their email addresses to us. So since those questions were not included, I'm pretty sure that that the audience that received the survey, as well as the audience that responded to the survey, include a whole array of characteristics, including people that, are totally competent, people who are homebound, using the Meals on Wheels program. So unless we pose those, our interest in finding those responses, we wouldn't know. But I'm pretty sure that, we covered, all areas. Unfortunately, I don't have the specific data to share with you.
Okay, thank you. We're pressed for time, and that's unfortunate because I think there's a lot more we could get into. I'll just say a couple things that jumped out at me, because if we have another session, or perhaps at the shameless plug, the Orange County Strategic Plan for Aging Technology Committee, we may want to talk about a couple things that jumped out, which is people's comfort and confidence level and where it needs to be improved. How do you do that? Nadia, you touched on that a little bit. One thing that jumped out at me was the number of people who their preferred methodology of doing stuff is on a smartphone. I'm not sure that would have been my guess. I would have guessed tablet for this age group, but that was interesting. And you're talking to somebody who always thinks my smartphone doesn't have enough screen size, so maybe I was just biased. And lastly, don't want to lose sight of the comment about maybe people don't want to learn, or they're not comfortable learning something new for a variety of reasons, and that may be something that we should delve into. And there was another survey result around 36% of the SCAC survey, people didn't have internet access at home, and that gets to the digital divide. Those are all topics you'll be hearing about if you follow the technology committee, because we are very heavily trying to sort that out, what the issues are in Orange County around what's called the digital divide. But we're out of time because I talk too much, and Patty, I think, is gonna take it over to we have Q&A, I think, going for all of the speakers and panelists. So I'll let Patty take over there. Thank you again, to the three of you.
Thank you, Ed, and thank you to our great panelists and to all our speakers. We do have a little bit of time because we haven't had a terrible amount of questions. Most of the questions that have been in our chat box have been answered along the way, either by the speakers or by our panelists just now. So if there are no more questions, we can wrap up, and we'll give you back 4 to 6 minutes of your day. It's really a pleasure to have had so many of you be part of this event today, and we hope that it enables you to take this information and then either enhance or expand the programs that you're currently doing, or maybe to check in with colleagues, some of the speakers that you've heard, and see what can be done to really continue broadening and deepening our contact with older adults who might be prone to social isolation. We know now that this is really a tremendous social determinant of health and well-being. And so we all have the same mission, that we want to improve the lot and improve the well-being and quality of life of the people that we serve. Thank you all for being here today. It's really a pleasure. We are so grateful to our sponsors, Scan Independence at Home, O'Connor Mortuary, and Care Choices Hospice. Their support enables us to be able to bring you programs like this. Ed, do you have some closing comments?
I do, and thank you, Patty. I would like to thank, first of all, Patty, you and all the people who organized this virtual conference. Our speakers, our panelists, you were wonderful. Melissa, our wrangler, organizing all this stuff, really want to say thank you to. But really want to thank our participants and the folks that are working to improve the health and well-being of our older adults in Orange County. Your work is heroic, more so since COVID than ever before, and it was already a tremendously heroic undertaking. I hope this has been helpful to you. I hope it stimulates further dialogue, further collaboration, because this is an issue that we may have a teachable moment around now that we didn't have earlier. So thank you again. And again, Patty, thank you for including me. And I'll look forward to the next one.
Well, you're a great co-host, and it's been a pleasure. Special thanks to Melissa Clabe. She not only was the wrangler, but she was the brains behind all of this technology, and she made it very easy for the rest of us. Thank you all very much. You will get an evaluation form via email, and we really, really want your feedback and your impressions so that we can do more of this and do it more to your specifications. It's been a pleasure. Have a wonderful afternoon, and thank you for the work that you do.